Megan. This is my horse health check video for Keeper 2. Today I have Bonita and my sister Annie helping me. So what we're going to be doing through this video is explaining to you how to take our horse's vitals. Now, what our vitals are is just kind of our horse's normal parameters for being healthy. Why it's important to know these is because it will help us potentially save our horse, know if our horse is feeling well, if they're feeling sick or not. So the first thing we're going to kind of go over is just our general appearance of the horse. How is our horse looking? How is our horse behaving? You know, we can start by kind of looking at her coat. This mare has dapples, her coat's shiny. So that's an appearance right there that we know that she's a little healthier. Her ears are forward, they're alert, she's paying attention, she's looking. You know, her eyes aren't glossed over anything, they're clear, they're looking healthy. We're going to also kind of look at her stance, you know. Is she agitated or is she just kind of standing there and being relaxed? Obviously, she's relaxed right now, so we're kind of just looking at that and seeing, you know, what's her demeanor. Things we can also kind of look at her feces or urine. You know, feces are going to be semi-firm, kind of yellow greenish type of appearance. You want to keep track of that. If it gets really dry, you're going to be, you know, aware that the horse might be getting dehydrated. You're going to want to look at urine color, making sure the urine's not any like reddish or yellowish, because that could mean there might be blood in the urine or things like that. You want to have that normal kind of yellowish to clear color. You're going to want to keep track of your horse's eating habits. Are they eating the normal amount for them? Are they leaving the food? Just kind of being aware about what your normal horse's behaviors are, which is why it's so important for you to spend time with your animal. Because otherwise you're not going to know what's normal behavior, what's not normal behavior. We have some horses who like to lay down and eat their hay. Some people might think that horse is coliking, but because we know those animals, we know that's a normal behavior. Now, outside of just our general appearance and normal parameters, we have our specific vital signs. So I'm going to go ahead and start with is I'm going to start at this front end and then kind of work my way back. So, what I'm going to start with is our mucous membranes and our capillary refill. So our mucous membranes are the conjunctiva of the eye and the gums in the mouth. Now, for our mucous membranes, if we look in, we want a healthy mucous membrane to be moist. So we're looking for that moisture in there, and then we want them to be pink. So hers are good and healthy. Different colors can indicate different things in the mucous membranes. A kind of yellowish color could indicate jaundice or liver problems. Bluish could kind of be like a lack of oxygen. You know, white could be anemic or shock, and then red could be a fever or an infection. So being aware of what those different colors indicate is really important. Now, we're also going to go ahead and take capillary refill. What this is this checks our hydration level in our horse. So what we're going to do for that is I'm going to go ahead and I'm going to curl her lip up. I'm going to press my finger above her tube and release. What we want is by pressing our finger, we're actually restricting blood flow to that area of the gum. We want that to return to a normal pink color in 1 to 2 seconds. Which hers did, so she's right in her normal parameter, about 1 to 2 seconds. You can also test her hydration levels by doing the skin pinch on the neck. Now what the skin pinch is, it's literally as it counts. Pinch. Now, this should return normal in 1 to 2 seconds. If it doesn't and it stays perched, that could also indicate that your horse is dehydrated. Now, you need to be aware of this also in older horses. Older horses can lose the elasticity in their skin, so their skin might actually stay pretty right now. But she's right here within our normal parameter, so we're not really worried about that. Now, we're going to go ahead and take her pulse. What her pulse is going to be is it's going to be right underneath her jaw on the maxillary artery. Now, what I'm going to do is I have Annie has my phone. She's going to go ahead and she's going to get my clock open. And what we're going to do for the majority of these vitals is we're going to multiply by 6. So she's going to time for 10 seconds and then multiply by 6 so we get 1 full minute. Now, for the maxillary artery, what I'm going to do is I'm going to find it and I'm kind of going to press on it, restrict the blood flow a little bit so it kind of pulses, and then I'm going to count with the rhythm. So whenever Annie's ready, and I let her know she's going to time in. There we go. Alright, she's at 6, so we're going to multiply by 6, 36, so she's right in our normal parameters, which are 32 to 44 beats per minute. Now, pulse can also be taken in one other place, which is going to be our radial pulse, which is on the inside of the back of the knee. This is a little harder to find, and as you can see by her reaction, it's not necessarily as favored by horses. We also have something called a digital pulse. You don't actually want to be able to feel this pulse. What the digital pulse means is that there's going to be some kind of lameness or disturbance to the foot. If you reach down and you feel the foot and you feel that digital pulse, something is wrong. Your horse might be thundering, there might actually be an abscess in the foot, there could be pain in the hoof. So when you're looking for your digital pulse, you don't actually feel it. That's one vital sign that you need to check. Now, since we're on pulse, we're also going to do heart rate. Heart rate and pulse are always going to be the same. 32 to 44 beats per minute. Now, if you're having trouble finding one, you can pretty much use the other interchangeably, but you want to be able to do both. So, when I'm taking her heart rate, I'm going to go right behind her elbow along the rate of the heart curve. And when I'm ready to have it, I'm going to give me time for 10 seconds, and I'll multiply it again by 6. Right, go. She's at 6 again, so 36, so it hasn't changed since we took her pulse on the maxillary artery, which is totally normal. And it's fine that it's on a little bit of the lower side of the norm since she's relaxed, she's calm, it's a little later at night. Now, we're also going to go ahead and we're going to do her respiratory rate. So, the normal respiratory rate range is 8 to 16 breaths per minute. You can also kind of use a range of 10 to 20. But anywhere in that range is going to be normal. How we take her respiratory rate is we're going to hold her slightly. And it comes out and then in. That is one breath together. So, since the respiratory rate is so low, you only have that 8 to 16 range, we're going to go ahead and we're going to time it for 30 seconds so I get a little bit more of an accurate reading of what her respiratory rate actually is. So whenever you're ready, Annie, I'm going to tell you. So I got 5, which is 10, so that's right in our normal 8 to 16 parameter. It's a little bit on the lower side, which is fine. So because it's late at night, she's normal, she's relaxed, she's calm. So now what I'm going to go ahead and do is I'm going to do gut sounds. Gut sounds on our horse, we have to check in 4 places. We have our upper quadrant and our lower quadrant on both sides. You need to check for sound in all 4 of those quadrants because your horse could be colicky in just one of those quadrants and it could be weak. So what we're kind of listening for is like a constant kind of gurgling, noise, whatever moving in our horse's system. We want to make sure that there's stuff flowing through their system. Now, if one of the quadrants is quiet, that could be an indication of colic. We also have something called hypermodal where there's more noise going, which could be an indication of diarrhea. So we don't want our horse to be hypermodal and we don't want them to be quiet. We want there to be a happy kind of balance of having constant gut sounds that aren't overactive. So what I'm going to do, so I'm going to go ahead, and I personally prefer to kind of face back so I can kind of watch her hind end. Annie's going to be communicating with me about her front end, her ears listening to me, because the ears are going to tell you a lot about, is my horse angry with what I'm doing? I'm going to kind of pat her, let her know I'm here, and I'm going to press my ear up against her and listen to her gut sounds. So right now she's having strong, consistent gut sounds, nothing sounding hypermodal, nothing sounding abnormal. And she's sounding good. I also have my stethoscope on me, which I use for heart rate. You can use your stethoscope for gut sounds, but normal, healthy gut sounds you will be able to just hear with your normal ear. I'm going to come around to my other side, letting her know I'm coming behind her with my hand present. I'm going to check her gut sounds on her opposite side. So gut sounds are active and normal. Gut sounds are active and normal on this side. So she's normal in all 4 quadrants, so we're not worried about this horse. So that's always a really good sign. The next vital sign I'm going to go ahead and take is going to be temperature. So what we're going to do with temperature is I have a normal digital thermometer here. I also have some petroleum jelly. This is purely lubrication to kind of help get the thermometer up into the rectum. All I'm going to do is I'm going to dip this in the petroleum jelly, kind of swirl it around, and this just makes it a little more comfortable for a horse. I kind of like to work all the way from her front end to her back end, letting her know I'm here, petting her on the butt. I'm paying close attention to her body language. What I'm going to do is I'm going to turn on my thermometer outside of her, wait till it says low, then I'm going to insert it 2 to 3 inches into the rectum, and wait for it to beep. Now, the normal parameters for temperature are 99.5 to 101.5 degrees, with the average being about 104. Now, her temperature right now is 100 degrees, so we're right in that kind of normal parameter, so I'm very comfortable with that. Now, you can also take temperature by using a mercury thermometer. All you have to do is shake that well down to below the horse's body temperature, and then you're going to insert that into the rectum, again about 2 to 3 inches, and you're going to want to hold it in there for at least 2 minutes. Then when you take it out, you can look for your reading. Something to be aware of for that is sometimes that can actually get sucked up into the rectum, so it might be handy to actually tie a string onto that thermometer so you don't lose it. Now, being aware of the temperature, your horse's temperature might be elevated after exercise, so you need to take into consideration how hot is it outside, what is your horse doing, and everything along those lines. Now, finishing in general overall appearance, we're going to still look at her, see if her vitals have changed since we started. There might have been an instance in which she got spooked and something might have been altered, so we just want to be aware of that. The whole time while we're taking vitals, it's always a really good idea to have a handler just in case anything happens. I'm always going to want to be communicating and being aware of what my handler is doing, and she's going to be talking to me. I'm also going to want to always be aware of the body language of the horse we're taking vitals on. It's important for you to know these vitals and know average vitals for your own animal, because in a time of crisis, you're going to be able to help your horse more if you're able to kind of convey that to your vet. So just being aware, knowing how to take your proper vitals, and being able to do it in a safe way is going to be the key to your horse's health. Thank you.